Most people don't know that an echocardiogram is one of the few exams where the doctor is talking the entire time. And if nobody translates it, you leave the room having understood nothing. International patients usually worry about the machine. What actually catches them off guard is the silence around it. I want to walk you through what happens inside that room, from where the patient is lying. The lights are dimmed. The cardiologist sits to your left, moving the probe across your chest, and the screen is angled away from you toward them. You will hear the sound of your own heart valves, and it is louder than anyone expects. The doctor speaks while they work, sometimes to themselves, sometimes to the assistant recording measurements. I stand where the patient can see me, and I translate the parts that matter. What's being measured, whether they need to hold their breath, whether they should roll onto their left side. I don't translate everything. Some of it is technical shorthand between the doctor and the assistant, and repeating it out loud only creates alarm about numbers that mean nothing without context. That's a line I've learned to hold. Before we sit down in the waiting area, I check the cue screen against our ticket number and the actual pace of the line. Echocardiography rooms don't run in strict order. An urgent case can jump ahead, and the display doesn't always update fast enough to show it. If our number is close, I keep the patient standing near the door. Miss the call here, and you don't get moved back one slot. You go to the end of the afternoon. The operational thing I always check: whether the patient is wearing a shirt that opens from the front. It sounds trivial. It isn't. A pullover means a full change of clothes in a small room in front of strangers, which is a stress nobody needs to add to a cardiac exam. Years ago, I told a patient the scan would take 15 minutes, which was true. What I didn't tell him was that the doctor would be silent for most of it, and he spent the entire exam convinced something was wrong. Now I explain the silence before we walk in. Understanding what's happening to you is not a luxury. For most patients, it's the difference between an examination and an ordeal.